A major effort at our center, both within the lab and in the clinic, is to come up with new strategies. How can we help patients to rebuild functional T cells after an allogeneic bone marrow transplant?
One of the complications after a transplant is the fact that the immune system takes a long time to recover. In studies that were done in mice in Dr. Vandenbrink's lab at MSKCC, he was able to show that IL-7 could actually help the immune system recover after transplant.
What we found using mouse models is that there is a window, that there is a period after an allogeneic transplant that lymph nodes can function as the sites where T cells can be generated.
And on the basis of that work in the mice, we've now done clinical studies as well. We were the only center to do this study in transplant. So the patients that we studied were patients who had undergone transplants using CD34 selection, where we removed the T cells. The patients all had what we call myeloid malignancies, meaning either acute leukemia or myelodysplastic syndrome. And the patients were actually quite old. The median age in the 12 patients that we treated was 60. And what we did in this small group of patients is we did a phase 1 study. And the idea was basically to identify a safe dose in which we could give the drug. The drug was given as an injection once a week. It was an outpatient treatment. It's given under the skin. And we monitored the immune system before and after the treatment. What we found is that in the majority of patients, the measurements that we had of their immune system before and after showed a significant increase in the immune system recovery after a very short course of treatment. And we were able to show is that not only do the T cell numbers come up, but we can also show that they function. They're able to proliferate when we stimulate them, and in patients with certain infections, we're able to show that there's a dramatic increase in the T cells that can fight that specific infection. So when we put these results together, what we found is that the drug was safe, it was very easy to administer, and it was an effective drug, even at low doses. And we showed not only that the T cell numbers went up, but also very importantly that there was an increase in function.